we have some confidence that we can continue to put money back in our business.
In the midst of rising prescription drug costs and a shrinking number of available pharmacies, local independent pharmacies are getting some extra cash from the state to help them stay in business. Good evening, I'm Paul Cicchini.
And I'm Jessica Coons. The state is finally implementing the $10 million Critical Access Pharmacy Program. This was included as part of last year's state budget, but was stalled by then Governor Bruce Rauner. Now the money should be coming through. WCIA3's Jennifer Jensen is in our newsroom tonight. So Jennifer, how does this program work?
Jessica, this money is for critical access pharmacies in counties of fewer than 50,000 people. Today, I talked to an owner of a local pharmacy in Paxton to get their perspective on how this might help. The pharmacy industry is in the midst of a major shift. While Andy Hudson says his family's pharmacy in Paxton isn't in danger of shutting down, he has seen profits plummet.
It's kind of scary when you see your profit on a small amount of prescriptions go down tens of thousands of dollars.
Some locally owned pharmacies are getting pushed out of business.
Our main competition is the insurance companies eroding our profits and having more hurdles to provide care to our patients.
In a news release, State Senator Andy Manar said throughout rural Illinois communities, consumers have experienced skyrocketing drug prices because of the poorly regulated pharmacy benefit manager industry. Those operations craft special deals with large corporate chain stores that small, independent, and locally owned operations can't compete with. The state is giving $10 million spread out to those locally owned and operated pharmacies to give them some relief. Hudson's Drug Shop was told they would receive tens of thousands of dollars. But even though Andy Hudson is grateful for the help, he says it's not a long-term solution.
It's almost a Band-Aid approach, but they are offering the critical access pharmacies money to make up for these losses that we've received through the managed care switchover.
Donna Watson has worked at Hudson's Drug Store for 5 years. While small-town pharmacies may be going out of business, she wants to remind people of the benefits of buying local.
At the corporate offices, you don't even know half the people, that you talk to on the phones, or if you have an issue or whatever, you don't even know them. Which here, you tell one of them you have a problem and they're going to get it figured out right away.
Pharmacies are still waiting for that money to be released. When Hudson Drug Store gets it, they plan to expand their business into Champaign with a mobile delivery service and update their technology. In the newsroom, I'm Jennifer Jensen, WCIA3, your local news leader.
All right, Jennifer, thank you. To put this in perspective, in the past year at Hudson Drug Store, the number of prescriptions filled went up 32%, but their profit went down by 83% because of the changes